Hi everyone, welcome back to the Pharmastudio series. In this video, we will be discussing the roles of pharmacists in immunization. We are glad to inform you that we are having Mr Huin Weng Kit, a registered pharmacist, as our special guest today to share on this topic. There will be 2 episodes for this topic. Hope you enjoy it. Here's a disclaimer before we proceed to the video. The views expressed in this video are solely representing the opinions of Mr. Huin and do not reflect any standpoints on behalf of the Malaysian Pharmacy Students Association, MyPSA.
Hello everyone, my name is Weng Kit. I'm a registered pharmacist. Today, I would like to give some sharing on the roles of pharmacists in immunization. Besides of the general vaccines as scheduled in the National Immunisation Program, Malaysia, actually public are encouraged to get influenza vaccine as well. Influenza vaccine is not compulsory, but public are encouraged to get it because it can prevent some influenza, or we call as flu virus, and also it can reduce the risk of complication for those patients having chronic illnesses if they get the influenza. At the vaccine center, pharmacists are usually on duty on the 3rd session, which is the consent taking station. Over there, pharmacists, doctors and dentists will work together to assess a patient's medication history, medical history and allergic history. Over there, we decide whether the patient are suitable to get the COVID-19 vaccines. We are also there to clear the myths from the public. Sometimes they will just ask some funny questions like maybe, can I bath after taking vaccines? So we are there to assure that what they can do or what they cannot do. Alright, so we are also there to tell them that let's say you have any side effects, what medication you can do. Okay, maybe some public will ask, can I take this medicine before the vaccine, or can I take that? Then from there we will tell them the correct info. So normally that side is more like a consent taker. We make sure they agree to take the vaccine, we will assess their history, and also are there to clear the myth, to answer their queries as well. So this is what pharmacists do in the vaccine center currently. So basically, I will summarize it in a simple way. I will say there will be a basic 5 roles of pharmacists. So as you all know, all medicines must be registered in Malaysia to be used by the public, alright, including the vaccines. So not only pharmacists and also the medical staff working at MPIA, National Pharmaceutical Regulatory Agency, okay, they are there to make sure to check the data, the safety, the efficacy of the vaccines before they can be approved to be used. Okay, there can be many meetings going on with the Drug Control Authority as well to make sure that the vaccine that we are bringing in is really safe and also have a certain efficacy. So after we buy the vaccine, we need to make sure that the vaccine can be sent to all the facilities, sent to all the hospital, clinics in a very efficient way without damaging the quality of the vaccines. As we all know, the combinative vaccines from Pfizer actually need ultra low temperature during the transporting when coming into the Malaysia. Okay, they need to be stored under -90, -60 degrees Celsius to make sure that the vaccine can be function effectively. After it was opened, it only can be used up to 6 hours. So within the 6 hours, we need to make sure that we finish off all the vaccines. Different vaccines actually have different storing temperature and different requirements. So it's very important for us to schedule the timing and to arrange the manpower to cater the need of these vaccines so that the cold chain will not be broke. So basically, pharmacists also in charge of transporting the vaccines, okay, from the vaccine storing center to the hospital and also facility. We will make sure the correct vials are being transported. Okay, that's roles of pharmacists as well. So pharmacists also have to report is there any side effects to the platform so that the data can be collected from the ministry side, then can analyze whether the vaccine are safe, whether there's a good efficacy, right? So all this data will be collected and also can be analyzed by the ministry as well. So basically, when we take the consent from the patient, we also tell them that if you have any side effects, you can report to the MyPSA app for the COVID vaccine. Because MyPSA app is specially developed for COVID-19, right? So they can report the data over there directly. So how about the other vaccines that maybe like MMR, BCG vaccines, or any common like flu vaccine, right? So that one we can do in manual way. Okay, we can teach the patient to report it to the system, or we can report it to the system directly. We can tell the pharmacist or the doctor in the clinic as well. So we will do the AEF. Right? Actually, after the patient took the vaccine, they'll be observed for 15 to 30 minutes. Okay, depends on his or her current condition. Then to observe any sudden allergic reaction or side effects on that. But that one is more to an acute side effect. But usually those serious ones, they will manifest quite fast. Like anaphylaxis, SOB, normally is within the 30 minutes. When you're allergic, your body will release some inflammatory mediators, then which can cause you to get the SOB or anaphylaxis. Pharmacists at the community pharmacy actually are the frontliner to really deal with the patient because they deal with a lot of public every day. So public will keen to ask them questions. Let's say they come to a store to buy some paracetamol to reduce the fever or the soreness at the injection site. So pharmacists are there to counsel them as well. Okay, there may be other public surrounding the pharmacy as well, so we can do the education together. Because community pharmacy is the most widespread healthcare facility as well. Previously, pharmacists are not allowed to vaccinate in Malaysia, but actually it has been a common practice in overseas like UK, US, Australia. Pharmacists can administer vaccine at the community pharmacy, but not in Malaysia yet. But just recently, so MOH has just announced that pharmacists can be vaccinators as well. The healthcare are evolving, alright. So actually Malaysia are taking many examples from the overseas as well. But this COVID has pushed it further because community pharmacies are available everywhere. And public no need to queue at the hospital or the very crowded place after that. So actually they can get a service from the community pharmacy which is nearby to their house at a scheduled appointment. Because like actually taking a flu shot, right, it will take about 5 minutes only. Even including observation, there will be about 30 minutes, but if you get the jab, it's very fast only, just few minutes. Alright, so these are the roles of pharmacists for immunization.
Here comes to the end of our very first episode. Thank you for watching and see you in our next video.